I'm Candace Oglesby. I am the director for Fluence's Ketamine Assisted Psychotherapy Certificate Program. I am also a trainer and mentor in this space as well. So, psychedelic assisted therapy came into my world, I would say, by a bizarre invitation. I actually had no experience with knowing about psychedelics prior to 2.5 years ago, and was afforded the opportunity to be a part of a clinical trial and got trained in ketamine assisted therapy right after that, and some other medicines such as MDMA, 5-MeO DMT. But it seemed like this was where I was always supposed to be. I felt like I had reached a plateau within my psychotherapy career. I had become an approved EMDR consultant offering EMDR, had been trained in internal family systems, and felt like I had reached the pinnacle. And so when I was introduced to psychedelic assisted therapy, psychedelic research completely shifted my world upside down, so much so that I am moving out of private practice to pursue this full time. What I feel like my clients get out of this experience is an opportunity to have exploration and curiosity within their own systems. And so, what I think they're giving is the space to be able to learn how to trust themselves, that whatever they need, their healing is already within them. I'm just the facilitator, I'm the holder of the space, make sure the space is safe, contain, but it's really their inner wisdom and their curiosity and their exploration is what's going to get them to healing. My hope is that my students are able to feel seen and heard within their cultural uniqueness and what they bring to what I like to call as the community of our class. How do we engage our therapists with this idea of taking care of themselves while they're in this space? And part of self-care is doing inner work, going to therapy, seeking out consultation, advocating for what they need in this space. And so within that, cultural considerations, we do want that to be acknowledged because that's part of the therapist, but really helping to sustain therapists once they come into this space. I feel like we cannot reach healing as individuals. Healing is required in community. And so I really want to operate from that framework that whatever space I'm in, there is the collective and that the healing is within the collective. Even when I'm working with my clients, they are in community with me and I'm in community with them. And so when I'm supporting them with, increasing their communities, getting more connected with the people around them, getting connected with themselves, that's when you start to see the healing really transform.
This video raises questions, and I need for you to be extremely honest in the comments when answering the questions. And just so you know, I have 3 questions. Number 1, are you an entrepreneur? Number 2, what type of business do you have? Number 3, what type of business do you want to have? Now, please be honest when answering these questions in the comments. Share this video with anyone you deem necessary, and don't forget to like and subscribe to the channel.